Is self-diagnosing harmful? Of course it is, because you will reinforce stigma, one, but two, you do not want to self-diagnose because you may think you have a certain condition, but actually you don't have a condition at all, or you might think you have depression, but you actually have something else, or you might have a combination of various things. So what is important is if you have done an assessment, which could be a DAS test, depression, anxiety, stress scale test, which is not a clinical assessment, but it's good to do because then you will be able to gauge, your mental health state during the time. And if your results comes out as severe or extremely severe, then you can proceed to a clinical assessment. If your results aren't severe, but you have, some sort of struggles, maybe it's, moderate, then you know that you have to do something about it. So it could be learning more effective coping mechanisms. It could be work-life balance, which can prevent you from getting a mental health disorder. I think what is most important is for you to listen and listen to understand. Listen for emotions, not listen to judge. Do not be quick to judge, especially when we lack the knowledge of mental health. Validate what the person is going through. And it could be as simple as saying something like, what you are going through right now, what you are experiencing right now is valid. That in itself will reduce a lot of the person's self-blaming or guilt or anxiousness, feeling of despair. That will reduce it a lot when the person feels validated. So that can be very, very powerful. You do not have to be there 24/7 in order to help a person, but just by saying, I'm here if you need help, is very powerful in itself. Okay. And of course, people with the condition do not expect you to be there 24/7 as well. What is important is lend a listening ear and do not be quick to judge. I think that in itself can save a life.